Hello everyone, I am Alice Balangidalayon, a student nurse from St. Tony's College Incorporated. So in this PowerPoint, we will be able to discuss about the proper waste management, healthier community, a nurse-led environmental health program. But before we proceed to our discussion, let's tackle first what is waste management and environmental health program in the next slide. So what is a waste management? It says here, it is a systematic process of collecting, disposing, and transporting garbage materials that can be either solid, liquid, or gas that produced by the humans. So, based from the definitions provided, ang waste management po daw is a sistematikong proseso ng pangongolekta, pagdala at pagtapon ng basura sa tamang lalagyan na nagmula sa mga dumi ng hayop, tao at mga industries or factories. Ito po ay isinasagawa upang mapanatili po natin ang kalinisan sa ating kapaligiran and to prevent the spread of illnesses and diseases. Next, what is Environmental Health Program? It is a public health initiative that assesses, manages, and prevents environmental factors such as pollutions, poor sanitation, and chemical hazards that causing illness and diseases. Kung sa Tagalog, ito ay isang programa ng pampublikong kalusugan na nagsusuri, namamahala at pumipigil sa mga panganib sa kapaligiran tulad ng polusyon at pagkalat ng mga kemikal na maaaring magdulot ng sakit at karamdaman sa mga tao o hayop. So let's move to our next slide, which is to identify problems. First, improper waste disposal is a serious environmental problem in many communities here in the Philippines. Sa katunayan po kasi, some of us hindi po nila alam magbasura sa tamang lalagyan, lalong-lalo na po yung mga bata na pakalat-kalat lamang sila sa kanilang pinagkainan. Even the simplest way on how to segregate their waste is hindi po nila alam tulad ng reduce, reuse, recycle, kaya ito po ay isang problema within our community and within our country. Second identified problems is throwing garbage in canals and rivers causes pollutions, flooding, bad odor, and diseases. This is a big reality kasi karamihan po kasi sa ating is patapon-tapon lang kung saang lugar katulad ng ating mga ilog o mga kanal na nagdudulot ng pagbaha. At kung minsan pa nga ay sinisisi pa natin ang ating mga government patungkol sa flood control, hindi naman natin alam o hindi naman natin ginagawa ang ating responsibilities as a citizen na itapon ng ating basura sa tamang lalagyan upang sa ganoon ay maiwasan natin ang pagkakaroon ng iba't ibang klase ng pollution, pagbaha at mga sakit na nakukuha sa ating mga basura. Third identified problems is the Ecological Solid Waste Management Act of 2000 requires proper waste segregation but many barangays still struggle to follow it. Paano naman kasi na hindi ito nai-implement even the barangay officials is hindi nila ito ginagawa. So, for you as a leader, you should do your role as a model na ipakita sa iyong mga mamamayan na ang waste segregation is important to keep our environmental clean and green. Lastly, the fourth identified problem is the poor waste disposal can cause pests, air pollution, and contaminated water that affect the people's health. Regarding with poor waste disposal, ito ay nagdulot ng pollution at itong pollution naman ito ay nagdudulot ng peste hindi lang sa ating mga tao, kundi na rin ang mga hayop. Katulad na lamang ng contaminated water na ating iniinom na nagkukos ng diarrhea at kung ito ay hindi maagapan kaagad-agad ay magdudulot ito ng kamatayan o death.
So I will present you the expected outcomes of our proposal. First, we expect increased awareness about proper waste management. This means that people in the community will learn how to properly handle and dispose of their waste. Second, there will be improved waste segregation practices at home. Households will start separating biodegradable, non-biodegradable, and recyclable waste correctly. Third, we expect cleaner surroundings in the community because people will manage their waste properly. There will be less trash in streets and public areas. Lastly, these practices can help reduce cases of dengue, respiratory problems, and sanitation-related illnesses. Since proper waste management helps prevent mosquito breeding and keeps the environment healthier. These outcomes aim to create a cleaner, healthier, and more responsible community.
So the target population of this study includes households and students in a selected barangay who practice improper waste disposal. This group was chosen because families and students are directly involved in daily waste management at home and in the community. By studying their behaviors and practices, we aim to understand the causes of improper waste disposal and promote better waste segregation and environmental cleanliness. For example, some households and students may throw bottles, plastic wrappers, and food waste on the same trash bin. Instead of separating biodegradable and non-biodegradable waste. This practice can lead to pollution and poor waste management in the barangay.
So, I'm going to talk about three objectives of proper waste management healthcare community. So, three objectives. Number one, by the end of the seminar, 85% of participations will correctly identify the four categories of waste: biodegradable, non-biodegradable, recyclable, and hazardous. This means that after the seminar, most participants should be able to identify the four types of waste. For example, they can tell that banana peels is biodegradable and plastic bottles is recyclable. Number 2, after the workshop, 80% of participants will demonstrate proper waste segregations. This means participants will show the correct way of separating waste. For example, food waste goes to biodegradable bin, plastic goes to recycle bin. And number 3, within 2 months, 60% of households will consistently practice waste segregations at home. And this means families will practice waste segregations at home within 2 months. For examples, using different trash bin at home for different kinds of waste. So, these objectives are important because they help people understand the type of the waste, learn the correct way to separate trash, and practice proper waste segregations at home to keep the environment clean.
May kusip. Ang tatalakayin po natin ngayon ay tungkol sa planned activities para sa ating community project tungkol sa waste management. Ang una po ay yung community seminar on waste management and health risk. Dito po, magtatawag po tayo ng mga eksperto para ipaliwanag kung bakit mahalaga ang tamang paghawak ng basura at paano ito nakakaapekto sa ating kalusugan. Ang halimbawa po lamang nito ay papakita nila kung paano nagkaroon ng sakit tulad ng diarrhea or dengue. Okay, ang next po ay demonstration of proper waste segregation. Hindi lahat ng tao ay alam kung paano ang tamang paghiwalayin ang mga nabubulok, hindi nabubulok at recyclable po. Parang ipapakita natin sa kanila ang plastic bottles, papel at lata ay dapat ilagay sa tamang lalagyan. Sunod naman po ay poster making activity, promoting reduce, reuse, recycle. Ito po ay activity para sa mga kabataan at lahat ng gustong makilahok. Gagawa po sila ng mga poster na magpapakita ng mga paraan para mabawasan ang basura, gamitin muli ang mga bagay at recyclable. Isang halimbawa, pwede silang gumawa ng poster na nagpapakita ng paggawa ng paso mula sa lumang lata o paggamit muli ng mga eco bags. Gaya po ng mga plastic bottles, gaya ng mga lalagyan ng yung mga Coke, mga Mountain Dew, ganun po, pwede po ulit natin gamitin yung mga bottles na yun. Then, meron po tayong community clean-up drive. Sama-sama po tayong maglinis ng mga daan, parke o ilog sa ating barangay. Halimbawa, isasagawa natin ito sa Sabado ng umaga at lahat ay dalhin ang sariling nilang gloves at lalagyan para sa basura at kaya tayo magdala ng gloves para maiwasan din po yung mga pagkaroon ng infection. At huli na po ay distribution of educational brochures. Ibibigay natin ito sa mga bahay-bahay para may paalala sila kahit nasa bahay na. Parang ang brochure ay may mga larawan at simpleng paunawa tungkol sa tamang waste management na madaling maintindihan ng lahat. Parang yung brochure po is parang yung guide po natin at doon tayo magbe-base. Thank you!
Good day everyone. Today, I will be discussing the important nursing roles and responsibilities. Nurses do not only focus for patients in the hospital, but they also help us to educate, protect, and to improve health of the community, just like other medical professionals working in Department of Health or City Health Office. Number 1, first nursing roles and responsibilities is nurses are health educators. They teach people about the connections between waste and disease prevention. When waste is not disposed properly, we all know that it can cause diseases like dengue or diarrhea. So, a nurse may teach families to separate biodegradable and non-biodegradable waste to avoid leaving stagnant water where mosquitoes can breed. Second, nurses are health advocates. They promote environmental sanitation and support programs that protect community health. In here, if a community has a poor garbage collection, a nurse can coordinate with barangay officials to improve waste management services. Third, nurses act as a community organizers. They organize activities that improves community cleanliness and health. In here, a nurse can organize a barangay cleanup drive or conduct seminars about proper waste disposal. And lastly, nurses are health promoters. They encourage people to practice proper hygiene and maintain safe surroundings. During a home visit, a nurse may advise a family to keep their surroundings clean and dispose of garbage properly to prevent pests and diseases like diarrhea or dengue. In conclusion, nurses help communities stay healthy by educating people, promoting sanitation, organizing community activities, and at the same time encouraging healthy practices. Thank you.
So moving on into our sustainability plan of our action plan. First is the partnership with the barangay officials and sanitation officers. This means that together with the barangay leaders and sanitation officers to support and continue the waste management program. For example of this, barangay officials help remind the residents to separate the waste management and trash properly. Then secondly, the creation of a waste management monitoring team. This means that a group that the volunteer or the barangay officials forming a group to check if the community is practicing the proper waste disposal. For example of this, the volunteers or the small team visits house to see if the garbage is properly separated. Then third, the monthly cleanup activities. This means organizing community cleanup every month to keep the environment clean. For example of this is the residents gather once a month to clean streets and canals, of course. Then lastly, the continuous health education sessions in school and community meeting. This means that the regular teaching people about proper waste management and its effect on health. Although although the ESO officers are doing this, but also we need cooperation to become a unity. For example of this, the nurses and the ESO officers will give a short talks in schools about proper waste disposal. That's all.
So let's move on to the evaluation method. First, the pre-test and post-test. Ito nga banda dati before and after dati itad mi nga short quiz kan after J discussion itad kami matlang ti short quiz nga di same ijay first tapno mamuan no anya tinaadal da ijay. For example, nag-itad kami ti short quiz tapos result na kitan minu anya tinaadal da or at dati baliwan da answers da. Then next, the follow-up survey after 2 months. Ito nga banda kat i-check mo dagijay insursuro mikat malagip kan i-practice da nga aramidan dagijay tataoy ti may nga community. Tapos i-check no effective ba diyay nga insursuro mi. And next, the observation and segregation demonstration. Ito'y kat apan mi i-observe no jay communicate kat aramidan dabag jay nga insuro mi na usto kasla no damagan mi dagijay residents nga alan dagijay basura kat observe mi no gusto jay way nga ikastada. For example, i-ask mi dagijay nga residents no nagpilot ti basura kitan mi no gusto jay kwan proper jay ikastada nga mang segregate iti biodegradable and non-biodegradable nga trash. And lastly, monitoring of reported sanitation related to diseases in the barangay health center. Kasla apan mi i-monitor no dagijay after J in practice dapat nag-decrease ba dagi J diseases kasla diarrhea kan dengue no nag-decrease ti cases na ije nga community tain apply da diay nga proper sanitation kan segregation iti basura kan i-check no helpful ba diay nga inaramid para ije nga community. And lastly, dagiti health records dapat minmayat or binmaba iti cases dagiti saksakit